A very warm welcome to each and every one of you on the Vishwa Shanti Darshan channel. We are here today in our campus for a very special reason. We have been bringing for you videos on spirituality, on philosophy, on peace. Today, we are here with a very special guest who has visited our campus. I speak about none other than the very esteemed surgeon who is the top of his field. And believe me, he has created a niche in the kind of surgery that he does. Let me introduce you to Dr. Ramin Goyal. A very warm welcome. Thank you so much for being in our studios today. Another interesting question I was thinking about, Dr. Saab, was what exactly is bariatric surgeon? Because when you talk to people about that, they have a lot of misconceptions in their mind. So please tell us a little bit about this.
So bariatric surgery is basically a keyhole surgery on the tummy where we reduce the size of stomach. So we sort of do plumbing on the stomach and intestine in a way that with a very small meal, the person feels full. And it's not a question of reducing the size of stomach. It also changes the hormones inside. It also changes the gut bacteria inside. And what that leads to weight loss. If a person is, let's say, 50 kg extra weight, the person can lose 40 kgs or more after that surgery within a short period. And more than the weight loss, it treats diabetes in almost 80% of the patients. They don't need any medicines. They don't need to take medicines for diabetes.
Okay.
And because their sugars become normal, they may not have a heart attack. They may not have a kidney failure. They may not have a brain stroke. And the diabetes-related deaths are reduced by almost 90%. So bariatric surgery is a preventive and therapeutic or treating surgery for many things like diabetes, like obesity, like in women PCOD. It prevents cancers of almost 13 types. So there are many things, and this is becoming increasingly popular worldwide, and especially in India it's even more relevant because we have very high level of diabetes and what we call as metabolic syndrome in India. So I think bariatric surgery is the future of treatment for diabetes.
So related to that, do you have to be a particular weight to get that done? How much should you be overweight? And is there any safe cutoff age for people to get it done? Because the older generation is a bit scared. You'll have the typical dialogue saying, I'm at the fag end of my life. Why do I need to get this done? Or maybe they say, I'm not yet that fat. So how does one identify that they need the surgery?
So it's very simple. I mean, there are scientific cutoffs and guidelines to there, but I'm not going to talk about that. If somebody is, let's say, 8 to 10 kgs overweight, then we can offer it for diabetes. If somebody is 15-20 kg overweight, then we can offer it for any other disease or obesity also. So but they are more technical things. That's not the issue. The issue is there are a lot of misconceptions among people because of the preconceived ideas that getting the surgery done is risky and things can go wrong. Things can go wrong even without surgery in people.
True.
And more people die because they did not have a surgery at the right time than by getting the surgery done. Surgery has become, now we are doing for 22 years, surgery has become very safe now. It's comparatively safer to have a bariatric surgery than to get a gallbladder surgery done or a hernia surgery done. Overall, the acceptance in the society is increasing, and as more and more people will notice that the data suggests that this surgery is a very good option, people are coming forward to get it done.
So I think even once the patient is convinced that I need to get this done because they've gone through the whole rigmarole of dieting and fasting and exercising without much success, it is a lot of the family members who hold them back, saying, try once more, go to another gym, take another diet. So I think more than the patients, it's the families that need convincing as to the safety of this surgery.
No, I completely agree with you. And I don't blame the family. It's their affection and love towards their loved one that they don't want to expose them to the so-called risk of surgery. But at the end, we have to trust the data. We have to trust the science. We have learned it harder way during COVID times. People were raising all kinds of doubts about vaccines and all, and we are all here today because those vaccines worked and we became safe. So I think the same thing is with surgery also, that there are a lot of misconceptions. But as far as the safety of the surgery is concerned, the safety has dramatically changed over the last 20 years. Anesthesia has become safe. Earlier, every patient will go to ICU. Now, not even one patient out of 200 will go to ICU. They are conscious within 5 minutes. They're able to walk by evening. And it is considered much safer than even a gallbladder surgery, which people get it done very easily. So I think what is required is more communications like these.
True.
Understanding by family physicians and other specialties that bariatric surgery has evolved over a period of time. We have become more experienced. Better equipments are available, and the techniques have evolved. So I think on safety front, I can say it cannot be better than this. It's very, very safe now.
I'm going to ask you a very funny question. A lot of patients, me included, whenever I have to approach a doctor, I first do my research.
That's right.
Which means Google Baba. So do you get a lot of patients who have done their research and maybe they have not gone to the correct sites, or I don't know, have they created an aura of fear in their minds? Do you think that it's a benefit having all that information out there, or is it a hindrance?
I think information is always beneficial.
Okay.
I'm very happy if somebody has gone through Google again and again and have seen YouTube videos and they come to us. It helps both ways. One is that they are already 60% informed about the procedure.
True.
And then they also know the wrong side of it. Now, it's my job to tell them that the wrong side that they have been exposed is a rare thing. It's like that if there are 10,000 cars going on a road, if there is no accident, nobody will put it in the Google that the 10,000 cars went by the road. But if there is an accident, they will put it out. I just have to tell patient this simile, that if something has gone wrong, it will be on the Google, and good, you know about it, and I can explain why something has gone wrong like this. So I think for me, a well-informed patient is a safer patient, is a better patient.
Okay.
And so many times I tell them that it seems you are not well informed, why don't you go and read on the websites? I agree there is a downside of believing in everything that is put on the Google. Everything is not right. And fortunately, COVID has taught everybody that there can be a misinformation which looks very scientific, but which is not correct.
And I think that's why I've always found you to be very modest, to be very humble, and to accept the fact that the younger ones are smarter than what we were. I think
Absolutely.
It may be the sheer exposure to the different technologies that are available now, but it's very humble of you to say so. And lastly, Dr. Goyal, I'd like to ask you that for somebody who'd like to take their first step into the field of medicine, who'd want to become a surgeon in the future, what advice would you give them? Because I do think this is the instant generation. They want everything immediately, they want everything instantly, whether it is success, whether it is fame, whether it is reaching the peak of their profession. What advice would you give to them?
So I think persistence and patience, these are the two important things. As long as you get enough to have 2 meals a day, don't be in a rush to make a lot of money. It comes your way, in everybody's way, on its own. So, the way quality control people talk, that you should concentrate on quality and not on the profits. The profits will automatically come. Same thing applies in medicine. If you are well trained surgeon, that is the basic requirement. I mean, without a proper foundation, whatever marketing you do or whatever promotion you do, it's going to fall flat. So get trained very well. Take your time. Don't be in a rush and compare yourself with engineers or software people. Because if you are well trained, you will be able to deliver consistently. Then have patience that it will ultimately, every doctor becomes successful over a period of time. And then persistence, as I said, keep getting trained, keep looking out for opportunities. Even now, I recently went for training for robotic surgeries, and I'm starting endoscopic bariatric surgeries. So when I go for training, I find people who are 20 years younger to me training me, and I'm very comfortable with it. I don't feel awkward at all, because I know they know their job well, and I want to learn from them. So I think these are the 2 or 3 parameters or traits a young surgeon or young medico should have in them. On everybody, in every field, I believe they are the same. And the last and probably the most important is having ethics or a character in your training. Is so important that you do things which are right. Everybody knows what is right and what is wrong. So if you are following the path of right, it will ultimately lead to a successful journey, and the journey will last long. The problem is not that you become successful. The problem is how long you can remain at the top of your career. And that only happens if you have been doing the right thing right from beginning.
What a wonderful answer. And we are nearly at the end of the time which has been given to us. But before we leave, I'm going to ask you a question which I know everyone out there wants to ask you. And that is, how do you manage your life-work balance? What do you do to disconnect? What do you do to recharge? Because that's what I think the youngsters today would want to know, that if we want to reach where Dr. Goyal has reached today, how do we get that balance in our lives?
I think that's very important question. So what happens is we are overstretched. Everybody is overstretched for time, for work, and the family pulls and pressures. We need to know how to disconnect. So in my way, I like to cook. I like to go for treks. I like to take holidays, and I completely disconnect from work. So I think everybody needs to find ways. If you know singing, or if you have an instrument to play, you should do it on a regular basis. And then exercising. So exercise regularly, or go for long walks, talk to family, talk to friends. They are so important, because working around the clock doesn't take you anywhere. That's not the way to achieve success in life or to be happy.
True.
So I think we need to have a balance, as you're rightly saying. How do you achieve a balance? Is by making sure that you know your priorities well. And like I early on in my career, I decided that I will not do late evening clinics and practice. So now I'm home by 5 o'clock, but earlier it would be say 7 to 8 in the evening at the most, while most of the doctors were working till 11 and 12 in the night. And that gives you time with your young children. They feel connected to you, and they don't feel connected at that time, but when they grow up, they know you were there when they needed you most. So I think it's probably very close to my heart, and I would not like to speak anymore on that. It's emotional.
Wonderful, wonderful. And that is such perfect advice, because that's what we all need to do in our lives. Whether you're a surgeon or whether you're a drummer, we really need to find that life-work balance. So on that note, I'm going to sign off. We hope in the near future to see a book by Chef Dr. Ramen Goyal. Thank you so much, Dr. Goyal, for speaking to us today. You're watching Vishwa Shanti Darshan channel. See you again next week, same time, same place.